Hello, people. My name is Christiana Mausi Serum, and I'm a public health practitioner. So, in our previous video, I talked about menopause, and menopause is when a woman misses her period for 12 consecutive months or for 1 year. In other words, if you do not menstruate for 12 consecutive months or 1 year, and you are between the ages of 45 to 55, you are likely to be diagnosed as having started your menopause. Okay, so now let's talk about the signs and symptoms of menopause. So please note that the signs and symptoms of menopause are centered around the decrease or the decline of estrogen level. So the first sign that a woman will see or experience is hot flashes. And hot flashes is a situation where the woman experiences a sudden warmth, and it's usually centered over her face, her neck, and her chest, and she begins to sweat profusely. So that is termed hot flashes, and this is due to the decline or the hormonal changes that are happening because of menopause. And it's very important to identify any food substance that triggers hot flashes for you as you've started your menopause. For example, in some people, hot flashes is triggered when they take in coffee or any caffeinated drink, any drink containing caffeine. That could trigger hot flashes for them. In others, alcohol, and then consumption of sugar. So you want to identify any food that triggers your hot flashes, or avoid, or take those foods in moderation to prevent the frequency of experiencing hot flashes. And one important thing too is that if you experience hot flashes, you can get a table fan, that small fan, and put it on your desk so that it can blow cool air over your face, your neck, and your chest. And this will keep your body cool and relaxed. The next sign that a woman experiences in menopause is the dryness or loss of hair. Estrogen maintains that silky, that fullness of your hair. So as estrogen levels begin to reduce, the woman begins to lose hair, and she begins to have very brittle hair. So your hair breaks easily. So when you comb your hair, you notice that you can see a lot of hair in the comb. Yeah, those are signs of menopause. Then dryness of the skin. The woman will also have dry skin. Estrogen gives us that silky, soft, smooth skin. So as your estrogen level begins to reduce due to menopause, your skin becomes more dry. So at this stage, it's important to get moisturizers, creams or lotions that can moisturize, keep your skin moisturized and lock in the moisture, and take more water and vitamins to keep your skin looking beautiful. The next sign in menopause is increased risk for heart diseases or cardiovascular conditions. Estrogen plays a very important role in supporting the function of the heart. How does estrogen do this? So what happens is that estrogen maintains the elasticity of the blood vessels. So once the blood vessels are elastic, the walls are elastic, it means that your heart does not need to pump blood with so much pressure in order to get the blood through those vessels to your body cells, tissues, and organs. So when estrogen level reduces, it means the elasticity has reduced. So now your heart needs to pump blood with more energy or more pressure in order to get the blood through your arteries, which are becoming a bit hardened. So that could lead to hypertension, that's high blood pressure. So it's important to get your blood pressure checked very often so that once there is a change, you will be able to identify it. Then the next sign that a woman in menopause will see is dryness of the vagina. So this leads to painful sexual intercourse. So what happens is that the woman is not able to secrete a lot of fluid, vaginal fluid, to make sexual intercourse pleasurable. So this is due to what? Decline in estrogen again. Estrogen maintains the vaginal wall, but once the level begins to drop, then there is what? The vaginal wall begins to thin out. The elasticity is also lost. So once there is penetration, the woman feels a lot of pain. So when this happens, it's very important to get what? Water-based lubricants, so that you can apply them during sexual intercourse in order to keep your relationship and also make sex more pleasurable. Then the next sign is what? Increased rate of frequency of what? Urinary tract infections. You get urinary tract infection, then you go for treatment. In few months or another month, you get another UTI again. And why will you experience frequent UTI around menopause? One, around that, from age 40, your urinary bladder is not able to empty completely. So there is what? Residual urine in your bladder each time you pass urine. So once there is that accumulation of that residual urine for over a period of time, that could result in what? The microorganisms or the bacteria, whichever organism is there, has the chance to multiply and cause infection. So you have what? Difficulty in urinating or burning sensation when you are urinating, and sometimes your urine comes in beads because you are in pain and so forth. Then another reason why you experience this frequent urine UTI is because the pH of the vagina increases. So when the pH increases, it means what? The acidity of the vagina, that's the normal flora, that medium, the acidic medium that the vagina maintains to keep off or to destroy any harmful bacteria or microorganism that comes there, has that defense system has reduced. So once there is any bacteria or microorganism around the vagina opening, that could easily pass into your urethra and cause urinary tract infection. And please, it's very important to go to the hospital for you to be treated for urinary tract infection, because if you keep it untreated over a period of time, it could ascend up into your ureters and even to your kidneys. So it's very important to get treated. And another thing you should also notice that because of this weak defense in the vagina, that reduction in the acidity, it's important to always wash your vulva with a lot of water, clean water, after sexual intercourse, so that you can flush off any microorganism that may be sitting there after sexual intercourse. So that will also reduce the frequency of experiencing urinary tract infection. So I've mentioned hair loss, I've mentioned risk or increased risk of developing heart conditions. I've mentioned dryness of your skin, breakage or loss of hair. Your hair becomes brittle. I've also talked about what? Vaginal dryness. So the next point is what? Increased risk of what? Weight gain. You can easily gain weight when you enter menopause. This is because estrogen is not able to what? Distribute your fats properly. Estrogen helps with fat distribution. So when there is a menopause, you tend to store fats, more around your abdomen, and that is not too good because it also increases your risk of developing diabetes and so many other conditions. Estrogen normally would apportion your fat, help with the distribution of the fat to your breast and your buttocks. That's why during menopause, you see that the buttocks begins to shrink. So the shape of the woman's hip begins to change. And then the breasts also change. They become more flappy. Yeah, they become more flappy. So it's very important to, note these signs and symptoms so that you do not get worried over them, and you seek medical care anytime you feel you are not okay or you are worried. That will help, calm you down, and then, it's part of life. We move. Then the last point is what? You are likely to have increased cholesterol level in your blood. Estrogen helps with what? Cholesterol metabolism in the liver. So when your estrogen level begins to reduce, it means what? You are likely to have a lot of bad fat, which is called the LDL, that's low density lipoprotein, hanging around your blood vessels and then clogging them up. So you need to watch your diet, exercise at this time to keep yourself active and healthy. Thank you.